Section number 1, the health plans, your choice through Cigna. This is a new benefit for January 1, 2017. So we're going to be switching to Cigna, and for all new hires throughout the year, the health plans will be Cigna. From left to right, we have plan number 1 and plan number 2. And then from top to bottom, we have A, office visits, B, hospitals, and C, prescription drugs. So you can see this is a snapshot of all your benefits. Again, all of those notices and summary plan descriptions and everything like that will detail more of the health plans, but this is just a snapshot, which most people are going to want to know about their health plan. First and foremost, there are websites at the top, and all of the websites are in orange. These are how to find providers for the HMO on plan number 1 and for the PPO on plan number 2. Okay, now it's different to find providers for plan 1 or plan 2. And it's also important to know that on plan 1, the HMO, you have to pick a primary care physician and go to that primary care physician before you see any specialist. They will refer you to specialists, but you have to go to the primary care physician first. So you're going to need to go to this website, and these words underneath the website are very important, so you can go and find that primary care physician or providers on that. Same with the PPO, but you do not have to pick a primary care physician with the PPO, only the HMO. You need referrals for the HMO. That is one of the big distinctions between Plan 1 and Plan 2, is that primary care physician and need the referral. Okay? Now, the benefits are a little bit different. I would say probably the thing for most of the benefits is that it's going to get a little bit better on the PPO than the HMO. Just everything's just a little bit better on the PPO, but the PPO actually costs more too. So you have to weigh what you want. So when we're going through here, you'll see office visits on line number 1. You have a 30 for primary and 50 for specialist. And then for plan 2, you have a 20 for primary and 40 for specialist. Okay? So, and here, again, you just have to go to the primary first on the HMO and then get referred to the specialist. Here, you can go straight to the specialist and not get the referral. So that's the difference there. And then you get into, I won't go over the whole thing, but I will go over line number 3. Annual preventative checkups are no charge. They're free. Make sure you go to healthcare.gov because that is actually an ACA Obamacare law that all preventative checkups are free that they list on their website. So go to healthcare.gov, type in keyword preventative when you get there, and then it should go over all the preventative checkups that are free. Chiropractic, 50 on the HMO, 40 on the PPO. Mental health, 20 on the HMO, 40 on the PPO. Then we'll get into hospitals. So starting on hospitals, line number 6, generally there is deductibles on health plans. Well, one of the benefits on the PPO, on the HMO, is that you don't have a deductible. So there's no deductible on the HMO. So out of the gate, when you go to the hospital or a surgery or inpatient or outpatient surgeries or MRIs, you don't have a deductible on the HMO. You do have a $500 deductible on the PPO. Okay, 2 times per family. So employee has a $500 deductible, spouse has a $500 deductible, no more deductibles after that. Then for coinsurance on line number 7, that is a percentage that you have to pay after the deductible. Okay, so when you're looking at coinsurance on the HMO, you pay 30%, and on the PPO, you pay 20% after the deductible. You don't have a deductible on the HMO, so you just pay the 30%. On the PPO, you pay 20% after the $500 deductible. And that goes for all of the hospital-related MRI, outpatient surgeries, those types of things. Again, make sure you stay in network with your websites. It's very important because you don't want to go out of network. Okay, and I'll explain that a little more towards the end of this playlist. Emergency rooms are $150 for the Plan 1 HMO, $50 for the urgent care, and on the PPO it's $250 for the emergency room or $125 for the urgent care. The out-of-pocket maximum means the maximum you're going to spend in a year on each plan is going to be $3,000 per person on the HMO and $6,350 on the PPO. Out-of-network benefits means on line 11 that you can go to a non-Cigna doctor, but I'd be very cautious when you do this. This is probably the most important thing of how people can get hurt financially on health benefits. So it's kind of important that you stay in network and not forget to look at the websites if you're planning a surgery or emergency rooms and stuff like that. Because you don't have out-of-network benefits at all on the HMO, so you won't be covered at all if you go to a doctor outside the network or you don't go to that primary care physician first on Plan 1. On Plan 2, yes, you can go out of network, but you have an additional, on line 11, $1,000 deductible, plus you're going to pay 40% to $12,700, which is different from this $500 or the $6,350 on line 10. It's a separate out-of-network deductible. I would really recommend you try not to go out of network and ask everybody if they're in network. Don't ask, do you take Cigna, PPO, or HMO? Ask, are you in my network? And I would talk to everybody, document who you talk to, everything like that, because this is one of those hot buttons that people get caught up in and it costs them more money. So try to stay in network and don't go out of network. Prescription benefits are a little bit different per plan. On Plan 1, the HMO, you have a $200 deductible that's separate from any copays up here before you get Tier 2 or Tier 3 drugs. So you have 3 tiers of drugs. Tier 1 is a 15, Tier 2 is a 30, and Tier 3 is a 50. So Tier 1, you wouldn't owe $200 first. But Tier 2 and Tier 3, you would have a $200 deductible first. On the PPO, there is no deductible first. There's Tier 1 is 15, Tier 2 is 35, and Tier 3 is 60. Now, if you want to know which drugs are under which tier, you can go to mycigna.com or Cigna.com will get you there. Log in or not log in and find the 3-tier drug list. If you can't find it, you can certainly email us. Our website is on the bottom, my email address is on the bottom of this form. Just email me. We'll send you a 3-tier drug formulary, which every single drug is on a certain tier. You can actually print it, email it to your doctor, and ask him if you could take maybe a lower price drug instead, maybe a Tier 1 instead of a Tier 2 or Tier 3. That might help you, okay? So those are all the benefits. Again, I can't stress enough to try to stay in network. Don't make it an accident if you go out of network by not asking. The ones to watch out for are radiologists, anesthesiologists, pathologists, emergency room doctors, and labs. Watch those. If you're going into a surgery, you got to ask the questions. Make sure you stay in the Cigna network. Okay. Now, let's move on to the enrollment worksheet, which these are the semi-monthly deductions. The salespeople could have monthly deductions, so it could look a little bit different. And in subsequent playlists, we might have old deduction worksheets on the screen, but the deduction worksheet that is in this link below is the correct one, or the one that HR would have handed you. So on the screen might be a little bit different deductions, but the format will remain the same. So here, go ahead and print your name at the top, because this will need to be turned in. And then for the HMO, if you want that, you'll circle either employee, employee spouse, employee child, or children. It could be 1 or 10 children, or the full family. All of these include the employee, and so you don't have to add any together. So you're either going to circle one of these numbers or circle the wave and put it in the far right-hand box. If you're going to wave, put it in the far right-hand box, a W, or write the word wave. Okay. For the PPO, same thing. Now, you won't take both plans, so you're going to waive one at least, if not waive both if you don't want either of them. Okay, so you're either going to waive one or both. Okay, and put a W or a waive in the far right-hand box. And then from here, we're going to be moving into the next section, which we're going to be talking about telehealth next. Don't forget about the mobile app that just got added there, which is a very helpful piece. So we're done with the health plans, moving on to the next playlist. Thank you for watching this section.